Good afternoon, everyone. My name is Priya. I'm a community pharmacist working in Watson's. Welcome to Watson's Ask Our Pharmacist Facebook Like sharing. If you would like to listen to our previous sharing, you can find them under the video tab of Watson's Facebook page. And for today's segment, I will be sharing about managing cholesterol. If you have any questions along the way, feel free to leave them as comments and I will address them at the end of this segment. Did you know that according to the disease burden statistics of Singapore, hyperlipidemia, also known as high cholesterol, is actually the most prevalent disease among adults aged 18 to 69 years old. About 33.5% of adults in this age group have high cholesterol in their blood, and this number even exceeds other diseases such as diabetes and also smoking. So why is healthy cholesterol level important to us? This is because high cholesterol in the blood is actually one of the main risk factors for heart disease and also stroke. Heart disease is second only to cancer as a leading cause of death in Singapore. It is therefore important to understand more about high cholesterol and how you control it. There are different types of cholesterol present in our body, and actually not all of them are bad. Cholesterols are important because they are actually responsible in the making of hormones, vitamin D, bile acids, and other important substances in our body. Our liver usually produces most of the cholesterol, but the rest of the cholesterol is actually contributed by the food that we intake. And there are basically three different cholesterols in our body. LDL cholesterol, which is the bad cholesterol, HDL cholesterol, which are the good cholesterol. They help our body to eliminate the bad cholesterol. And lastly is triglycerides. They are actually the major form of fat in our body. Triglycerides are actually stored unused calories, which actually gives our body with energy. As some of the cholesterols are actually contributed by the food that we eat, it is therefore important to be aware of what we actually consume in our diet. A good tip is actually looking at the food labels and being aware of the type of fat that we actually intake. The type of fat that we want to avoid are basically saturated and trans fat. Saturated fat can be found in food products such as ghee, lard, and full cream products, whereas trans fat can be found in food sources such as fried foods and processed foods. These types of fat tend to increase the bad cholesterol, which is LDL cholesterol, in our body, and some may even lower the good ones. Thus, avoid diet that is basically high in saturated and trans fat. Instead, look out for unsaturated fat or the good fats. So there is basically two types of unsaturated fat available in our diet, which is the polyunsaturated fat, in short PUFA, and monounsaturated fat, which is MUFA. This unsaturated fat helps to reduce the bad cholesterol, which is the LDL, and they can be found in food products such as avocados, olive oil, sesame oil, salmon fish, and even sardines. Okay, so apart from choosing the healthier type of fat, another way is we can also limit food intake that are high in cholesterol. Although cholesterol is only found in animal product, this does not mean that we should totally avoid eating meat. We should always aim to have a balanced diet which incorporates carbohydrates, proteins, fruits, and vegetables. The recommended dietary intake of cholesterol per day is 300 milligrams, and those with established high cholesterol levels can actually limit it to 200 milligrams per day. We can actually counteract the levels of LDL in our body by actually taking more fiber in our diet, especially soluble fiber. So soluble fiber actually helps to remove this LDL cholesterol because it binds in our small intestine and eventually we will excrete out in the feces. food containing high level of soluble fiber is, for example, dried beans, oats, apple, strawberry, peas, and even potatoes. Another quick tip I want to mention here is when we prepare food, we can try healthier cooking methods such as grilling, boiling, or even steaming. So these methods do not only keep our body healthy, but also keep your kitchen clean from oil stains from deep frying lah. So when eating out, you can actually consider for example, choosing plain rice instead of flavored rice, choosing noodle soup instead of fried items, asking for less gravy and try not to finish up all the gravy or soup, and lastly asking for more vegetables. Okay, so besides controlling our food, right, what else can we do to better manage our cholesterol? Having an active lifestyle actually works hand in hand together with our diet. About 150 minutes of moderate intensity exercise per week, which is actually equivalent about 20 minutes per day of brisk walking, cycling, or even dancing per day. However, do discuss with your doctor on a suitable exercise plan if you are already on any long-term, if you already have any long-term medical conditions. Next is to live tobacco free. Don't smoke, vape, or use any tobacco products, as smoking can actually damage your blood vessels and reduce your good HDL cholesterols. There is actually nicotine replacement therapy sold in the pharmacy to help quit smoking. You can always feel free to approach any of the pharmacists if you need help. If you're a non-smoker, avoid second-hand smoke because that can also cause serious health effects. Moving on, a very common question encountered by many pharmacists in the community pharmacy is that are there any supplements that can actually help to reduce my cholesterol? The answer is yes. There are supplements out there in the market that can help to reduce your cholesterol, such as red yeast rice and plant sterol. But do take note, supplements don't replace your prescribed medications from your doctor for your cholesterol, yeah? So you always have to speak to your doctor or any of the friendly pharmacists before you actually want to take any supplements for cholesterol. So to summarize, here are actually the 6 tips that I can recap for you to better help manage your cholesterol. Firstly, number 1, being aware of the type of fat we consume. Number 2, increasing the fiber intake. Number 3, choosing a healthier cooking method. Number 4, exercise. Number 5, live smoke-free. And lastly, take supplements only when needed. Alright, now let's see if we do have any questions. Alright, so there's a question from Mabel. High cholesterol brings fatty deposits on face, especially on eye area. How to remove it? Okay, so this fatty deposits on eye area, right? Before you actually decide to remove it, I would suggest that you actually get it checked with a doctor. What is it actually caused by cholesterol? Then we can eventually come up with a plan on how to actually remove these fatty deposits lah. Then we also have a question from Teo Jun Ning. How often do we need to screen for cholesterol? Okay, so unfortunately, high cholesterol in fat in itself, right, it doesn't have any symptoms. So that means you won't know that when you have it without visiting your doctor for a routine screening lah. So our MOH recommend that you actually get screened for high cholesterol when you are aged between 40 years or older, or when you are 18 and older, and you have any risk factors for blood vessel disease such as diabetes, cigarette smoking, hypertension, or even if you have a family history of blood vessel diseases, right? So you can actually go for routine screening as well. Okay, so how fiber brings down cholesterol? So like I mentioned, so this question was from JJ Wang. How fiber brings down cholesterol is, like I mentioned, it actually binds the fiber actually binds to the bad LDL cholesterol in our small intestine, and eventually that will actually excreted out in our feces lah. Another question from Danny Ong: is atorvastatin good for cholesterol? Okay, so atorvastatin is a medication, a prescribed medication given by a doctor to treat cholesterol. So yes, if you have high cholesterol and your blood test results shows it and your doctor recommends it, do take your medicine. So okay, besides that, so I've already addressed Mabel. Oh, okay, there's another one. Any side effect on the drugs? So basically, when you take statins, right, atorvastatin, it belongs in the group of statins. So a few things that you can take note is that any unexplained muscle aches lah. So for example, right, you didn't do any physical exercise, but suddenly you feel that your body is very aching, very painful, especially your thigh and back muscles. So those are signs of like muscle breakdown, I would say. But before you these ones, right, usually not, so you need to differentiate. Like if you know that you do any very vigorous physical exercise, then you know your body will be painful lah. But if you didn't do any, if you have any of those symptoms, then it's good to get it checked with the doctor. Okay, so we have another question, like what are the recommended levels of HDL and LDL cholesterol? So the Singapore Health Promotion Board, right, actually recommends the following cholesterol levels, and it is optimal for both men and women. So for example, total cholesterol less than 200 milligrams per deciliter, or your LDL cholesterol should be less than 130 milligrams per deciliter, or HDL cholesterol, which is a good one, should be more than 40 milligrams per deciliter. Alright, let me see. So generally, right, I'm seeing there's a lot of questions about supplements. Okay, so generally, how do I put it? Okay, so supplements, like I mentioned just now, right, red yeast rice, plant sterols, they actually help by lowering the liver production of cholesterol, which then helps in lowering the bad cholesterol LDL and also the fat in our blood, which is the triglyceride. Whereas plant sterols are compounds that help to block your body from actually absorbing the cholesterol. So while the plant sterols actually help to lower the LDL cholesterol, they actually don't appear to have any good effects on the HDL or triglycerides lah. Okay, so we have time for one more question. Yeah, actually, omega-3 and fish oils, right? So these ones, there are studies out there to show, but eventually, the evidence behind it, you will need to speak to your doctor or pharmacist whether do you actually need it. And anything else? Okay, I think we have already reached the maximum time for this session, and that's the end of it. So I hope that you have enjoyed and learned something from this sharing. If you have any more questions, feel free to leave them as comments. I'll be here for the next 3 hours to address your queries. Thank you everyone, and have a nice day, and do stay safe as well. Thank you.